Hey, can I ask you, does he need to be on the backboard? It's a fairly long transfer. This new protocol represents a very significant change in practice.
That significantly changes.
It's a significant change from prior immobilization practice here in New Hampshire.
Well, the protocol was changed because studies have shown that extended time on a backboard can actually be detrimental to the patient.
There's no evidence to show that it proves that it does any good, but there's evidence to show that it does harm to the patient. Hello, I'm Vicki Blanchard, a paramedic and the ALS coordinator with the New Hampshire Bureau of EMS.
I'm Eric Yeager, a paramedic and a member of the New Hampshire EMS Protocol Committee.
I'm Jim Swosey, EMS Medical Director at Cheshire Medical Center and a member of the Medical Control Board.
I'm Tom Dupree, the State Medical Director for New Hampshire.
Wait a minute. Why is this patient on a backboard? He's got a possible T1, T2 spinal fracture. He needs to be immobilized.
Hi, my name's Eric.
The Medical Control Board has approved a new spinal trauma protocol.
2, 3.
How are you?
In most cases, the spinal precautions will consist of a collar and having the patient lie down on the stretcher.
The long backboard can induce pain, patient agitation, and respiratory compromise.
Steve, what happened here today?
I crashed my truck into the woods.
Okay. All right. Do you have any injury?
No, I'm
Okay.
fine.
All right. How does your head feel?
No, it's fine.
All right. How about your neck?
No, it's okay.
Okay. When I palpate down your spine, do you have any pain, tenderness, or tingling?
Nope, none at all.
Okay. All right. How about your arms? How do your arms feel?
I got a little bit of tingling on this arm, though.
On this arm?
Yeah.
Okay. Can I see
Feels
your hands
weird.
for a second? All right. Squeeze my hands for me. All right. Can you feel me pinching?
Yep.
Okay. And you said a little bit of numbness and tingling in this arm?
Yeah.
Okay. All right. How about your legs? Your legs feel
I
okay?
got that tingling down my left side, too, here. My
Same,
left leg,
same
yeah.
thing. Okay, can you feel me pushing on your toes?
Somewhat, yeah. That one's good.
Can you wiggle them for
Yep.
me? Okay. All right, Steve, based on your complaints, I think what we're going to do is take some spinal precautions, and we're going to apply a collar to your neck, okay? Okay. How's that? Not too tight? You can still breathe okay?
Yeah.
All right. Steve, my partner has the stretcher right behind you, okay?
Oh, okay.
Nice and easy. We're going to go ahead and sit you down.
It's right behind you.
Again, keeping your head nice and straight and in line. Okay. All right, now what we're going to do is you're going to turn to your right. You're going to kick your feet up onto the stretcher, and then we're going to lay you down. Okay. Steve, any change with that movement?
No.
No. Still just that left-sided numbness and tingling?
Yeah.
Okay. All right, we're going to put a couple straps over you to keep you secure to the stretcher, all right? Your head and neck feel okay?
Oh, yeah, it's fine.
All right, when I palpate down the back of your neck, any pain or tenderness
No.
there?
No.
How about the back?
Nope, all set.
Okay. You said your shoulder was a little sore?
Yeah,
Okay. How about your chest? Feel okay?
that's okay.
All right. How about your abdomen?
It's a little tender down
A
there.
little sore? Okay. How about your hips area?
You feel okay?
Okay. All right. How about your arms? Any numbness or tingling?
Not that I can feel.
All right. Can you squeeze my fingers for me? All right. All right. Can you feel me pinching?
Yes, I can.
All right. How about your legs?
Fine.
All right. Can you wiggle your feet for me?
Yeah.
No numbness or tingling?
No.
Okay. You feel me pinching right there?
Yep.
All right. At this point, you can go ahead and release inline stabilization, sir. I don't believe there's any reason why we need to take any kind of spinal precaution here. Do me a favor, just go put your head side to side. Any change, any pain with that? Numbness,
No.
tingling? No?
No.
Okay, and can you go up and down? Any change with that?
No.
Okay. All right, let's go ahead and take your seatbelt off. Sir, just given the fact that you were in an accident, you got some shoulder pain, some pain to your abdomen, I think it'd be a good idea to take you off to the emergency department at the hospital, get evaluated. Does that sound okay?
I guess.
Okay. All right, let's have you hop out. Nice and easy.
All right, Steve, we're here in the hospital room. You're going to feel us lowering you down a little bit now. And we're going to get you transferred over in just a minute.
Remember, keep your head nice and still.
Wait a
for
minute,
us.
wait a minute. Why isn't this patient on a backboard? He's got a possible T1, T2 spinal fracture. He needs to be immobilized.
Hi, my name's Eric.
I'm Jean.
Gene, nice to meet you. So we didn't have any orders from the sending physician or the sending hospital to have him on a backboard. While he does have a possible fracture, we have spinal precautions in place. He's got a collar on, and we've asked him to lie still. And I'm not sure whether you know, but New Hampshire recently changed its EMS protocols. And the EMS protocol relating to this says that long backboards don't really have a place in transferring patients between facilities any longer.
Well, those are your protocols. My trauma guidelines say that any person with a possible spinal fracture needs to be on a board. I can't accept him if he's not on a backboard.
We understand that, but at this juncture, we can't backboard him. The physician at the sending hospital cleared his spine and can be transported without a backboard on. We can move him with minimal spinal movement.
Well, I'll probably have to write an incident report, but I suppose we'll just go ahead. I don't want to, delay the patient care, and I don't want to discuss this here. We can talk about this later.
Okay, well, Gene, I want you to understand, we're honestly not trying to be difficult or give you a hard time. We're trying to follow our protocols, give the patient the very best care that we can. If you do have questions, I can put you in touch with our supervisor who understands that receiving facilities may have some questions about this new protocol. And it may be worthwhile for you to call the sending facility and talk to the physician there.
I can do that later, but let's go ahead and take care of this patient and get him moved over.
No problem?
Hey guys, thanks for coming.
Hi, Doc. We're going to be taking him down to Mass General?
Yes. Yeah.
Okay. Hey, can I ask you, does he need to be on the backboard? It's a fairly long transfer.
Well, he had a skiing accident and hurt his neck. He's been complaining of neck pain, and on X-ray he's got a C6 transverse fracture. It looks stable, but we always transport them on a backboard.
I hear you, and that is how we've always done it. I'm not sure whether you know, but New Hampshire EMS has issued a new protocol on the use of backboards that includes what to do in inter-facility transfers, and what it says is long backboards do not have a role for patients being transported between facilities. And obviously, if you end up ordering us to take them on a backboard, we will do that, but the protocol does ask me to raise the question with you whether we really need to take them on a backboard.
Really? He's on the board. I kind of would prefer, now that he's on the board, to be on the board.
Well, the protocol was changed because studies have shown that extended time on a backboard can actually be detrimental to the patient. So we prefer to get him off, but if you're insisting that we need to do it, then we're going to need to take some time to really make sure that he's padded well, so we can minimize any risk for him.
Well, if that's the new protocol, I'm okay with that. It is a long trip, and these boards are not comfortable and do have some possible complications. So if that's your new protocol, I'm okay with that. Let's take him off the board.